2, and 1. Okay, now we're going to do chapter 14. So let me share my screen and let's get through chapter 14. And that is on nutrition intervention and diet drug interactions. So this chapter, we are going to list examples of nutritional interventions and talk about procedures that are used when we provide nutritional care. We're going to talk about how we can kind of estimate what a patient's energy requirements can be in the hospital setting and what kind of dietary modifications we have available, things like pureed diet or mechanical soft, to modify those diets to fit the needs of the patients, and how the food service departments plan menus, provide meals, and maintain safe food handling practices. We're going to identify the different types of diet drug interactions with some examples, and we're going to talk about complementary and alternative therapies and how they differ from conventional medicine, supplements, and the various types of alternative therapies that are available out there. All right, so same thing, we're going to care plan for the patient, what their nutritional needs are. And there's always going to be a dietary order based on what that patient needs. And that comes from the doctor, but it comes from the doctor as part of the healthcare team. Everybody collaborates. So we care plan, we assess, we come up with a diagnosis. As nurses, we do this every day. The nursing process is called ADPI, assessment, diagnosis, planning, intervention, and evaluation. And what we do is we figure out what's wrong, what could go wrong, what can we do? Let's do it. And then let's evaluate it. Did it work? Yay. If it did, okay. If it didn't, then we modify and start all over again. We have to look at long-term dietary intervention because we have to consider what that patient is currently doing, right? What are their current food practices? What's their lifestyle? And how motivated are they? And are they ready to change? Because you can't force someone to do it. We try to talk about here's what you should eat rather than say, this is what you shouldn't eat. And you can't make big changes. I say this all the time, and here it is in black and white. Baby steps. When we have to make changes to our lifestyle, I don't like calling it a diet, you make a little change, right? Because a little change will be easier to keep. If you try to make massive changes, you're going to be resentful, and it's not going to take very long. You're going to go, I'm done with this, and go back to your old habits again. And we educate the patients, make sure that they understand, what is the disease process that they have. And when we educate, we always take into consideration things like, what's their age, what's their literacy level, what's their learning style, what's their cultural background. All those things, are important to take into consideration. We will always look at someone's resting metabolic rate. So that's what is your metabolic rate when you're not exerting any energy, just for you to be alive, just to be. And we can also adjust that resting metabolic rate for stress factors. So in other words, when you're stressed, believe it or not, arteries get tight. Your metabolic rate will increase, not in a good way though, right? So we really have to take the patient's life and their lifestyle into consideration when we're looking at these things. So there's a table on slide 9 that gives the equations that are used for estimating that resting metabolic rate. And there are 2 kinds of equations, the Harris-Benedict and the Mifflin-St. Cyr. I will tell you right now, don't worry about it. That's not something that we typically do. The dietary department will typically do that if they need to really get those kinds of specific numbers. Let's see. And then we'll talk about dietary modifications. There are lots of different types of diets available. So somebody's got, if they're edentulous, in other words, they don't have any teeth, or they're missing most of their teeth. Sometimes you'll find people that are missing teeth, but they have dentures, but they don't fit right because either they've gained or lost weight, and so they don't use their dentures. Well, you can't eat steak without teeth, right? So it's hard to gum things. Do they have swallowing issues, dysphagia, because they've had a stroke, right? That's an issue. So when we talk about these different types of foods, mechanical soft, that's kind of like chopped up. Pureed is like baby food, right? It's pureed. They can also have a soft diet where they eat things like, mashed potatoes, those kinds of things. Most people that are on a dysphagia pureed diet hate the diet because they feel like the food is bland, but it's the same food. Like if we're all having steak and sweet potatoes, then the kitchen will take the steak and sweet potatoes and put it through the blender and puree it. I think part of it, this is my own personal opinion, doesn't reflect the opinion of Atlantic Cape Community College or any of its affiliates. I think it's more of a dignity thing with people because they feel like they're eating baby food. I've had several patients over time tell me that. But again, if you have dysphagia, that means there's a problem with the epiglottis. It's typical after a massive stroke. So when they swallow, that epiglottis kind of doesn't shut completely, and food or liquid can go down into, instead of going into the esophagus, can go into the trachea and go into the lung, and they can wind up with what's called aspiration pneumonia, which is very bad. So, the dietary orders are really important. I've never in my life heard of a blenderized liquid diet. So that is on this slide, but I can't explain it to you because I've never seen that word before. That's crazy. I'm going to look that up when this is done. However, you will see a clear liquid diet or a full liquid diet. So clear liquid diet, it's always fun because it's any liquid that's liquid at room temperature. So Jell-O, even though when you stick it in the fridge, it hardens, when it's at room temperature, it's liquid. So Jell-O is a clear liquid, right? Anything that you can see through is a clear liquid. So in other words, it's not a great thing because the bottle's got print on it, but if the iced tea were in a clear glass, you'd be able to see through it. Tea, coffee, water, obviously, those kinds of things are considered clear liquids. Never anything that's dairy. Once dairy gets added, then it's no longer clear liquid, then it's a full liquid diet. And they're specific for, let's say, someone's had surgery. So post-operatively, sometimes they have a delayed gag reflex from being intubated while they're on the table. And so we have to slowly wait for the gag reflex to come back, and then we'll give them ice chips, little sips of water, then we'll get them on clear liquids, and then we'll slowly progress them back up to whatever their original diet was right before the surgery. Fat restrictive diets, there's so many different specific diets out there. They have a sample of a clear liquid diet. Strained orange juice, because orange juice is not a clear liquid, because orange juice and grape juice are the two juices that tend to have pulp. Even the pulp-free orange juice, you'll find a little bit, so they can strain it. Gelatin, ginger ale, coffee, tea, they can have sugar. Like I said, just no dairy, right? They can have bouillon, consomme. Consomme is cold soup, by the way, if you don't know what that is. It's gross. And bouillon is like chicken broth or beef broth. And they have cranberry juice here, but in the hospitals, we do not give cranberry juice as part of a clear diet. So anyway, there can be low fiber diets, low sodium diets, right? Depends on what the needs are. High calorie, high protein diet. For example, people with, say, breathing disorders like COPD. If you can't breathe, you have a hard time eating, right? Because in order for you to eat, chew, and swallow, you have to kind of hold your breath, right? Can't breathe at the same time. So they tend to be very malnourished and not eat. So we try to get them as much bang for the buck, like high protein shakes and those kinds of things, so they get what they need. Like I said before, the doctor is responsible for the dietary order. NPO, those three letters, means nothing per os. It's Latin, so it means nothing by mouth. Okay, so that is a dietary order as well. So if you're having surgery, and you're going to be having anesthesia, they will say that you have to be NPO after midnight the night before, because we don't want anything in your stomach, because if you vomit, you can aspirate while you're on the table and then you can die. And that's not a good outcome, right? Let's see. As far as food safety is concerned, when surveyors go to facilities like hospitals and nursing homes, they are always going to the kitchen and the dining room as part of their survey, because they want to make sure, are the patients getting their trays? Is the food hot? Or is that such a delay that by the time they get it, the food's ice cold? And are the foods being stored in a way that's safe so we don't have to worry about different things like botulism or E. coli, right? Now let's talk about diet drug interactions. So, and there are lots of them. So different drugs can alter food intake because certain medications can make you lose your appetite or they can make you nauseous. Antibiotics, right, are a big one for GI upset. Different drugs can affect your absorption, metabolism, or excretion. And there are interactions between certain specific components of certain foods and then certain medications. The first one that comes to mind, anticoagulants, warfarin, Coumadin, is an anticoagulant. Well, if you're on warfarin, you have to be very consistent in your intake of green leafy vegetables because they contain the most amounts of vitamin K. Vitamin K is the antidote for warfarin. So if you're eating too much vitamin K, the warfarin's not going to be able to do its job. Get it, right? Lots of drugs can cause xerostomia, which is a dry mouth. Sometimes they can inflame the mouth, stomatitis. Chemotherapy is a big one for that. Sometimes drugs can make you nauseous. We can give you another drug to make you not nauseous called an antiemetic. There can be actually damage to the GI tract by anti-neoplastic drugs, that's chemotherapeutic drugs, and also antiretroviral drugs. And those are the drugs that we use to treat HIV with a lot of success now these days, actually. And then, you know, your stomach acidity has an impact on nutrient absorption. So for example, like you would never ever take a Rolaids or a Tums at the same time that you would take most oral medications. Why? Because the acid in the stomach is necessary for breaking down the chemical content of the pill that you're taking, right? Except for extended release or enteric-coated pills, because they don't break down in the stomach, they break down in the small intestine. But, you know, there are lots of things to take into consideration that all have to do with, you know, absorption and how your body handles these two different things together, right? And there's always some type of an interaction that has to be taken into consideration. Antacid drugs also impair your absorption of vitamin B12 and folate and iron. Vitamin C enhances your absorption of iron. And then antibiotics and anti-inflammatory drugs, B-lactamase inhibitors come to mind, the cephalosporins like ceftriaxone, they have an impact, and that's not on here, this is me ad-libbing. They have an impact on nutrient transport through the cell walls. So lots of different drugs have lots of different effects on nutritional status, right, and absorption. Talked about stomach acidity already. Let's see, methotrexate. Yeah, I mean, I don't know if I want to get into all that, but so methotrexate is an anti-cancer drug, a chemotherapeutic drug, and it resembles folate. So when you take methotrexate, your body sees it as folate or folic acid. Lithium, that's not on here, but this is my favorite. When you think lithium, you think salt. For a person that's on lithium, which is a mood stabilizing drug, usually used for mania, bipolar 2, lithium is perceived by your body as sodium. So if you don't eat, and that's the only time you must eat salt, is if you're on lithium. Because if you don't get enough sodium in your diet, your body will start to hang on to the lithium, thinking that it's sodium, and you'll get toxic, right? Crazy, right? And then they're antibacterial. This isoniazid is a drug for tuberculosis, and that inhibits the conversion of vitamin B6 to the coenzyme form. So in other words, it impairs your ability to absorb B6 if you're on isoniazid, which is a very common treatment for tuberculosis. Here you go, warfarin and vitamin K, but I already told you about that. Who's good? And there's a list here with a table actually that goes through the different categories of drugs and the different types of things that affect them. Grapefruit juice is huge. There are so many drugs that do not like grapefruit or grapefruit juice. A lot. It's crazy. The cholesterol lowering drugs, especially like Lipitor and Zocor, atorvastatin, simvastatin, they do not like grapefruit juice. No, there's an enzyme that is very specific to grapefruit juice that has a chemical interaction with a lot of these medications. Isn't that crazy? Yeah, grapefruit juice is a no-no with a lot of drugs. Let's see. And then, oh, tyramine. So there's a group of drugs called monoamine oxidase inhibitors, MAOIs, and they are one of 4 categories of drugs that are used as mood stabilizer drugs, antidepressants. But this particular category, the patient has to be instructed to stay away from foods that contain tyramine. And tyramine, sadly, is in high content in most delicious foods, like aged cheese, pizza, bar foods, craft beers, pepperoni, dried beefs, those kinds of things, all are loaded with tyramine, and avocados too. And so if the patient's on an MAOI and they take in too much tyramine, that interaction with that drug will cause something called serotonin syndrome, which is very dangerous. High fever, hypertension, they need to be hospitalized with that. So there's so many different food drug interactions. I mean, I'm sitting here thinking of other ones to tell you guys about because there's so many that aren't even, listed all here. Right, soy sauce, that's the other one that's got tyramine in it. Uric acid, anybody heard of gout? Right, so gout used to be called the rich man's disease. Why? Because foods that are rich, brown gravy, lobster, scallops, filet mignon, loaded with purine. Purine, when you eat foods with purine, converts to uric acid in the body. Excessive uric acid causes gout. So they used to call gout the rich man's disease. Yeah. So let's see. Oh, this is my favorite, complementary and alternative types of therapies. This is saying that about 40% of adults use some form of either a complementary or alternative therapy, excluding prayer. I didn't realize that was the therapy. Okay. Self-help these days, it makes me crazy. And I will say this, when you're looking at the internet, always make sure that you're looking at a credible site, right? Everyone has an opinion, and that's fine. You are all entitled to your opinions. I'm entitled to my opinion, but my opinion doesn't make it a fact. If something's a fact, I can back it up with empirical evidence, right? It's not just me going, well, here's what I think, right? So always, please, if you don't take away anything else from this class, this is a big pet peeve of mine. So much bad skinny is out there, bad information, so much. And people sometimes just believe, they go on Facebook and go, oh my God, guess what? My kid should be sleeping 18 hours a day. What? I had a neighbor ask, they say that, I'm really worried about my son. Her son's 3. She said, he should be sleeping 18. I said, 18 hours? No, he's 3. Where'd you see that? I don't know. I think on Facebook. So you get my point, right? Okay. I didn't realize there was a National Center for Complementary and Alternative Medicine that was established in 1998, and its mission was to fund scientific studies and provide authoritative information to consumers, healthcare professionals. Interesting. So when we talk about these different types of alternative and complementary therapies, naturopathic medicine, homeopathic medicine, Chinese medicine, acupressure, acupuncture, manipulative therapies, that would be things like chiropractic, right? Mind-body interventions, meditation, guided imagery, biofeedback. There are lots and lots and lots of them out there. As long as they're not harmful, I don't ever have a problem with them. And if the patient believes that they help, then they help. You know what I mean? But sometimes they can be harmful when people use them as an alternative to regular science. And then the big problem with alternative therapies are that, and it says, I like this book. This is one of the first textbooks that I actually like because it agrees with science. There's no regulation and oversight with herbals and supplements. So when you buy anything that's an over-the-counter herbal, and listen, Black cohosh, they say, is for menopausal symptoms. Saw palmetto is for prostate problems. Valerian is for anxiety. Chamomile is for rest and sleep. I could go on and on. I mean, there's so many out there. Kava kava is also for sleep. There's no evidence behind those claims. There's no scientific research where we took a heterogeneous sampling of the population and gave them all glucosamine and chondroitin, and this was the control group, and this was the group that actually received those, supplements, and here's what we found. There's none of that, and that's the problem. That's one of the problems. The other problem is that if it says 1,000 IUs, yeah, maybe, could be 100, could be 10,000, because there's no oversight to what goes into those capsules and pills. So you don't know what you're getting because there's no regulation. People still to use them. And they say that this complementary and alternative therapy that was the mission is to educate patients regarding the hazards of postponing or discontinuing conventional therapy and going with, I had a hospice patient that had stage 4 cancer and went to Hollywood, Florida to get vitamin C infusions because it was going to cure her cancer. Took her last savings. I don't know how people sleep at night. I don't. I just don't. What do you think? Vitamin C to cure cancer? If that, drink some orange juice, right? No, it didn't work. She died. Yeah. So let's see. Lack of regulation, we talked about that. And that's the end of this chapter. Drop the mic again, guys. Kaboom. All right, let me stop this recording and peace out.